Hi everyone, welcome back to Happy Healthy Smiles. Thanks so much for joining me. My name is Farah. I'm a registered dental hygienist. So today I want to discuss dental care and the special needs patient. So communicating problems and mental capabilities are some of the major concerns when treating patients with intellectual disabilities like Alzheimer's, dementia, Down syndrome, and autism. Now, unfortunately, a lot of times dental care is often neglected or completely overlooked. And dental care is really important. Regular checkups and regular cleanings are important to prevent things like tooth decay, gum disease, pain, and infection. Plus, you want to address things early on. We can catch them when they're small instead of later on when it's much more bigger and more stressful, and financially, the cost is very high. And remember, the healthy mouth means a healthy body. Now, before even the dental appointment, a couple of things I want to go over. So you might want to have a short consultation with either the dental hygienist or the dentist regarding the patient. We want to know what spectrum they're on. Are they very independent, or are they need 24-hour care and they can't be left alone? So this will help us with communicating at the patient's level so the patient can understand. So we want to go over medical history first. So make sure, please keep a list of all medications and milligrams. This helps us assess what these medications are doing. A lot of these medications have oral side effects. I know a few cause dry mouth or gingivitis. So this way we can review the medications and go over the side effects individually. And also we want to know what other healthcare professionals the client is seeing. If they're seeing a cardiologist or say a physiotherapist, we might need that information to collaborate with them for certain things. It's good to know also what allergies a patient has. Very, very important, especially with medications. We want to know if they're allergic to penicillin or amoxicillin in case we are prescribing these in the future. So medication allergies, always put them down. Also allergies to latex, anything like that is very important. Any recent hospitalization, or is a client going in for surgery soon? So that's also really good to know. We'll also review the dental history. So make sure you write down the last time they had a cleaning and checkup, if they've had x-rays recently, and if they can be transferred to the office. Also, we want to know if there were any major dental work done. And does the patient have any dental concerns, or do you as a caregiver have any dental concerns about the client? We would also like to know if there's any damaging oral habits that you know of. Things like bruxism, grinding and clenching is one. If they're picking or chewing on their lip or gums. If they are issues with a lot of saliva buildup or tongue thrusting. If they have a condition called pica, P-I-C-A, which is an eating disorder where the person's eating non-food items like dirt or gravel. It's also good to go over the intolerance to any light, sound, touch, contact. If there's any triggers like a loud noise or any triggers that might affect the dental appointment. Now, at the dental appointment, make sure that you fill out all these forms beforehand, because sometimes it takes a bit long, so you don't want to get that client already frustrated and tired of waiting. So have the office email you or fax you these forms to fill out. Pick a time that is convenient for obviously you and the client. Don't pick a time where it's their meal time or their nap time. And also try to stay with the same hygienist and the same dentist. Consistency makes a big difference. The client will get used to that person and feel safe, and they build a bond and a trust. So that's really important to keep that same person for the appointment if possible. I know during emergency appointments that's sometimes difficult. Also, we will do a show, tell, do approach, where we explain and show the instruments and what we're going to do and how things work, like say the saliva ejector, and then we'll proceed very slowly and gently. And don't be surprised, sometimes it might take 1 or 2 appointments for that person to feel totally comfortable so we can finish the whole appointment. Now, home care, very, very crucial. Very important that the person is brushing minimum twice a day, if not more, and somehow flossing or using anything, even like proxy brushes if flossing is not possible. These come in a lot of different sizes, so this is very useful. Pick a manual brush that has a soft and very small compact head and change them often, 2 months. And if they can tolerate electric brushes, go a long way if they can tolerate the noise. And if they are supervised, please make sure they're brushing for 2 minutes if the caregiver is doing 2 minutes minimum, if not more. And make sure you are going especially around the gum line. That's super, super important, so to prevent any cavities or any gum disease. Another something good to note is the diet. It plays a huge role. Try to avoid pop or juices. Stick with water. And if they're having milk, make sure they rinse or brush right after, pretty soon after. Avoid anything soft, sticky, sugary foods as incentive or rewards. If you are using food as a reward or incentive, try apples or carrots. That is much healthier and won't cause a lot of plaque buildup. And fluoride toothpaste is really helpful, and make sure they can spit out because you don't want to be having them ingest the fluoride daily. I hope all these tips have helped. If there's any questions or comments or you have any good results, please leave them in the comments below. I'd love to hear from you. Otherwise, take care and see you soon. Bye.